Welcome to MenopauseWize, your go-to podcast for all things evidence-based in the menopauseverse. I am Dr. Sukhpreet Patel, an MD gynecologist, a menopause health advocate, a postmenopausal woman, and the founder of MenopauseWize. And I'm so excited to have you join us on this journey. Whether you're a healthcare provider looking to stay on top of the latest evidence-based practices, a woman navigating your own perimenopause or menopause journey, or a partner or family member eager to support a loved one, this series is designed with you in mind. Our mission through MenopauseWize is to close the menopause knowledge gap by bringing you the latest research, expert insights, and practical advice, empowering you to make informed decisions about menopause and perimenopause. Today, we're starting a series on a critical but often under-discussed topic, the Genitourinary Syndrome of Menopause or GSM. We'll be breaking down what GSM is, how it affects women's health, and why it's important to bring this into conversation with your healthcare provider. This first episode will focus on understanding GSM, what it is, what causes it, and its impact, before we explore treatments in future episodes. So, what is GSM? The Genitourinary Syndrome of Menopause refers to the collection of symptoms caused by a reduction in estrogen levels that primarily affect the genital and the urinary systems. These changes happen during and after menopause, and they can significantly impact a woman's quality of life. GSM affects the vagina, vulva, urethra, and bladder, often leading to a range of symptoms including vaginal dryness, burning, irritation, and pain during intercourse, as well as urinary symptoms like frequent urination, urgency, and recurring urinary tract infections. GSM may not be as well known as hot flashes or night sweats, but it's incredibly common. Estimates suggest that between 27 and 84% of postmenopausal women will experience GSM symptoms depending on the population and how long it has been since menopause began. In fact, research indicates that about 80% of women experience GSM symptoms just 6 years after entering menopause. Despite the high prevalence of these symptoms, many women are unaware that GSM is a direct result of menopause. One of the reasons for this is that GSM often develops gradually and many years after menopause. By this time, most women have mentally moved past the idea of menopause, believing it's over once hot flashes subside, and completely unaware that other symptoms like GSM are just beginning to surface. While vasomotor symptoms like hot flashes tend to improve with time, GSM tends to be progressive, meaning that without intervention, symptoms can worsen over time. So let's talk about the symptoms in more detail. The most common symptom of GSM is vaginal dryness, which occurs as a result of thinning tissues in the vaginal walls caused by low estrogen levels around perimenopause and menopause. As the tissues become thinner and less elastic, they lose moisture, leading to discomfort and irritation. For many women, vaginal dryness caused by GSM makes sexual activity painful, which can strain relationships and reduce libido or sexual desire, which anyway takes a beating around this time. Beyond the physical discomfort, GSM also affects emotional well-being. Pain during intercourse often leads to a reduction in sexual activity or even complete avoidance of intimacy. In fact, according to the Real Women's Views of Treatment Options for Menopausal Vaginal Changes Survey or REVIVE, 85% of women reported that GSM symptoms led to a loss of intimacy, and nearly half felt it negatively impacted their relationship. For women who are not sexually active, GSM can still cause significant discomfort. Even without sexual activity, symptoms like vaginal dryness, irritation, and urinary issues can affect daily life. Simple activities like walking, exercising, or sitting for long periods can become uncomfortable. Vaginal dryness can also present as a burning sensation between the legs, discomfort during exercise or routine activities, and chafing or cuts around the labia and surrounding areas. In addition to vaginal dryness, many women with GSM also experience urinary symptoms. These may include frequent urination, urgency to pass urine, and dysuria, which is a medical term used to describe discomfort, pain, or a burning sensation during urination. Some women may experience recurring urinary tract infections, which further complicates their health and adds to the discomfort. These urinary symptoms occur because the tissues in the urethra and bladder also rely on estrogen to stay healthy. When estrogen levels drop, the tissues can become thin and more vulnerable to infections. While these symptoms are common, many women do not seek medical advice for GSM. In a survey of postmenopausal women, almost 50% reported they had never used any form of therapy to treat their symptoms. One reason for this is that women may feel these changes are just a natural part of aging, something they must live with. However, GSM is not something that women should have to endure without help. Addressing these symptoms can significantly improve comfort and quality of life. It's also important to note that GSM doesn't only affect women who are going through natural menopause. Women who experience early menopause due to surgery, chemotherapy, or other medical treatments are often at a higher risk of severe GSM symptoms. For these women, the sudden drop in estrogen can cause more pronounced changes, and they may experience the effects of GSM much earlier and more intensely than those going through natural menopause. For healthcare providers, it's essential to proactively ask women about their symptoms. Many women may not recognize the connection between their symptoms and menopause, or they may feel too embarrassed to bring it up. However, early identification of GSM can lead to effective management, helping to prevent the condition from worsening and improving a woman's quality of life. A simple, direct question about vaginal dryness or discomfort can open the door to important conversations that lead to appropriate care. It's important to remember that symptoms of GSM can have far-reaching repercussions beyond just physical discomfort. The need to pee all the time and vaginal irritation can make everyday activities like walking, exercising, or even sitting for long periods of time uncomfortable and discourage women from participating in these health-enhancing activities. At the workplace, frequent urination or discomfort from sitting can interfere with productivity and concentration. Additionally, GSM can affect emotional well-being, leading to feelings of frustration or isolation as it often impacts intimacy and relationships. The need to urinate multiple times at night can disrupt sleep and leave some women exhausted through the day. And, most importantly, when left untreated, these symptoms can progressively worsen, affecting both a woman's personal and professional life, highlighting the importance of addressing GSM early on. GSM can be addressed through the use of non-hormonal over-the-counter options such as lubricants and vaginal moisturizers, and hormonal options such as low-dose vaginal estrogen. Each treatment has its own benefits and considerations, which we will cover in detail in upcoming episodes. For now, it's important to know that there are many options available and women do not have to suffer in silence. And this brings us to the end of today's episode on the Genitourinary Syndrome of Menopause or GSM. Here are a few takeaway points for this episode. The Genitourinary Syndrome of Menopause or GSM is common, affecting 27 to 84% of postmenopausal women and causing a range of genital and urinary symptoms due to a decrease in estrogen levels. Symptoms of GSM are diverse and progressive. These include vaginal dryness, irritation, painful intercourse, frequent urination, urgency, nocturia, and recurrent urinary tract infections. Without intervention, GSM symptoms tend to worsen over time. GSM can significantly impact quality of life. Beyond physical discomfort, GSM can affect emotional well-being, relationships, and self-esteem, especially in cases where sexual activity becomes painful or intimacy is avoided due to symptoms. GSM can disrupt sleep and hinder productivity at work, extending its impact far beyond just the vaginal and bladder symptoms, affecting overall well-being and daily functioning. GSM is not restricted to just those experiencing natural menopause. Women who have undergone early menopause, surgery, or cancer treatments often experience more severe and rapid onset of GSM symptoms. There are multiple treatment options available for GSM, ranging from over-the-counter non-hormonal lubricants and moisturizers to low-dose vaginal estrogen and other hormonal options, which we will cover in our next episode. Before we go, a quick medical disclaimer. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. always consult your physician or a qualified healthcare provider before making any decisions regarding your health or any medical treatments discussed in this podcast. While we strive to provide accurate and up-to-date information, this podcast does not replace professional medical consultation, diagnosis, or treatment. If you have any concerns or symptoms that require medical attention, please seek advice from your healthcare provider. Thanks again for tuning in to MenopauseWize. Stay informed, stay empowered, and I'll see you in the next episode as we continue to navigate the menopause journey together. If you're a healthcare provider interested in collaborating with us or have insights to share, we'd love to hear from you. Please email us at info@menopausewize.com. That's wise with a Z.